Hello guys, today I will discuss about important causes of large gut diarrhea. Large gut diarrhea it can be because of CA colon, Crohn's colitis, amoebic colitis, pseudomembranous colitis, then microscopic colitis because of use of excessive omeprazole. But these are the main causes. CA colon, as far as CA colon is concerned, in the history of CA colon, we usually find an elderly male, and the risk factors for the CA colon are obviously hereditary causes, which can include hereditary non-polyposis colorectal carcinoma, adenomatous polyposis coli, and many other. So you can remember it like that there is a subgroup of hereditary causes. Then after that, people who are smokers and alcoholic consumers, they are at high risk of developing CA colon. Then after that, obesity, obviously, and then use of processed food and many other. As far as the symptoms are concerned, usually patient may present with altered bowel habits like diarrhea alternating with constipation, abdominal pain, fatigue, breathlessness, and large gut diarrhea with blood. And as far as amoebic colitis is concerned, obviously there will be history of infected food intake. Usually people will be taking food from outside unhygienic sources or unhygienic water intake, and patient might present again with large gut diarrhea, small in quantity, with blood and tenesmus, history of tenesmus. Then after that comes a pseudomembranous colitis. There will be history of prolonged use of antibiotics for some other reason, for any other illness like cephalosporins, or there might be use of prolonged PPI that might lead to the diarrhea of pseudomembranous colitis. Then after that, microscopic colitis, again it is a non-specific colitis which is caused by excessive use of PPI. So as far as the diagnosis of large gut diarrhea is concerned, as I've already told you, history of different diseases. Signs are also very important. Pallor can be present in case of CA colon, and wasting in CA colon, as well as in amoebic colitis, although it will be unlikely in pseudomembranous colitis. Then there can be tenderness, abdominal tenderness can be present in various areas of abdomen, like in the lower abdomen, in the right iliac fossa, or in the left iliac fossa, depending upon which part of colon is usually involved. And there might be wasting or lymphadenopathy. Then after that comes investigations. Investigations are routine investigations and specific investigation. In routine investigation, the important ones which can show us something in the support of our diagnosis might be CBC showing anemia. That can be microcytic hypochromic anemia, or it can be normocytic normochromic. ESR can be raised, and stool in which motile trophocytes can be present in case of amoebic colitis, and it can be positive for occult blood in case of CA colon. And then after that, we have indirect hemagglutination tests, which are immunological assays of antibodies, and which is quite supportive in case of amoebic colitis if test comes to be positive. Then after that comes the specific investigations, non-invasive. First I will discuss, which can be barium enema, and in the case of CA colon, there can be variable presentations like loss of oscillation. We can see strictures or apple core appearance, and things like that. Then carcinoembryonic antigen, again it's a tumor marker which can be positive in case of CA colon, and it also helps us in monitoring our treatment of CA colon. If it is decreasing, it means that our treatment is getting successful. As far as the treatment of CA colon is concerned, it depends upon the stage of the colorectal cancer. Obviously, it can be surgery, and it can be radiotherapy or chemotherapy or palliative management. Intestinal amoebiasis, asymptomatic amoebiasis who are just cyst passer, just give diloxanide furoate. Otherwise, we have to give metronidazole, IV, depending upon the condition, or oral. In pseudomembranous colitis, treatment is withdrawal of antibiotics, and the antibiotic like metronidazole or vancomycin or predoxamine can be given in more serious cases. Thank you.